We can begin with your name, your health center, the city you serve, and the state you're located in.
St. John's Well Child and Family Center. It's a network of free medical, dental, and mental health services and clinics in South Los Angeles, California.
And your name and role within St. John's?
Jim Mangia. I'm the president and CEO. We were seeing a tremendous number of patients with HIV. South LA is a hotspot for people with HIV. And so we began doing routine testing as part of our practice and found a significant percentage of patients that had HIV and had no idea that they had it. And realized that if we were able to do early intervention and primary care services for these patients, that it would have a profound impact on their health. So we decided it was critical that we move forward on this.
Now, when was this?
This is probably, well, we've always had a large number of HIV patients that have come through the clinic, but we often had to refer them out because we didn't have the in-home services. But the intensive testing began about a year and a half, 2 years ago, and we just saw the incredible demand for those services in our primary care center. We would tell people we were going to refer them out, and they didn't want to be referred out. They wanted to receive their HIV care at our clinic. So we thought it was really important to start developing that. I think we have a long history in South LA. We've been there for 46 years. We have deep roots in the communities that we serve. And I think it's very difficult for people to consider going outside of South LA to receive care, particularly to receive care that they've been confident in receiving at the community health center with their physicians. I think there's a lot of stigma and transportation issues in Los Angeles. South LA is a very isolated community. It's about 1.5 million people live in South LA, but it's extremely difficult as far as transportation and access to get out of South LA. It's one of the big problems, and so many people will live their whole lives and never leave South Los Angeles and never go to downtown LA, for example. It's just an extremely isolated place. So we thought, and people want the cultural sensitivity and the relationships, especially something as sensitive as HIV care. So what we were finding is that patients were increasingly talking about, I have HIV, but you're sending me out, and I don't want to go out. I want to get my services here. I think the biggest challenge is just training our providers, making sure that the culture of the agency is amenable to providing this care. We've begun discussions about this, and the staff seems very supportive of it. But I think there's going to have to be some culture shift and culture change. I think the biggest barriers are the stigma that is pervasive in South LA around HIV, and that St. John's is not immune to that. We're part of the community. We're very, very closely connected to the community. So I think the biggest challenge is to make sure that we're trained up and that that we can provide the best quality, the highest quality care to our HIV patients, and obviously that the resources are aligned, because as a community health center, there's not a lot of funding specific to HIV care. So how do we integrate it into our current funding streams? How do we make sure that that the revenue is maximized as we do this going forward? The pharmacy's expensive. There's just many different facets that we have to consider as we move this forward. But we're committed to doing it. And, we're actually setting a July 15th date to really go live on providing the care. Yeah, I think it's critical. I think the edge, the competitive edge that community health centers have in the healthcare reform environment is that we are patient-centered medical homes. And obviously we're not the full scope of what a patient-centered medical home needs to be, but for all intents and purposes we are patient-centered medical homes. We have the broad wraparound of services, we have case management, care coordination, we have a lot of the components, just not as coordinated as they need to be. So I think that it's critical, and it's critical for improvement and quality of care for patients. having that embedded in an HIV practice and using the HIV practice to hone those patient-centered medical home skills is going to be key, and I'm really looking forward to that. I think it's a perfect segue for us to really drill down and look at what are the key components that have to be developed and implemented to be a full-scale patient-centered medical home. And I think providing care to the HIV population is a perfect example of that. I don't think it happens unless community health centers have a critical role in implementing it at the local level. I think it'll be a fully integrated HIV care program.
Okay.
I think it'll be the ability to track population health of the HIV population that we serve, to produce data, and most importantly, to show health improvement, to show stabilization and health improvement for the HIV population. I think those would be the key components, and also that there's a tremendous. I think we need to make sure there's a tremendous amount of outreach and education that goes along with that, so the community is educated that HIV is essentially a chronic disease now. It's not a death sentence, and that it's better to find out early and to do something about it than to wait. And so I think if we can bring in all of those different components I just laid out, I think we'll have been successful.